How important is asleep fiber optic intubation in medical procedures, you ask? Well, let's begin by understanding that intubation is a critical process in many medical procedures. It ensures that the patient's airway remains open and oxygen supply is maintained. And when it comes to complex cases, asleep fiber optic intubation emerges as an invaluable tool. Asleep fiber optic intubation is like the secret weapon in an anesthesiologist's arsenal. It's not always needed, but when it is, it can be a real game changer. Imagine a patient with a challenging airway anatomy or a patient who has experienced severe trauma, where traditional intubation methods may pose risks. In such cases, asleep fiber optic intubation becomes a safer alternative. Why? Because it allows doctors to visualize the patient's airway using a fiber optic scope, giving them a real-time view of the situation. This method provides a high degree of control and precision, reducing the risk of complications. It's akin to having a roadmap to guide you through an unfamiliar city. But it's not just about the patient's safety. Asleep fiber optic intubation also ensures the comfort of the patient. The patient is asleep during the procedure, unaware of the process, and spared the discomfort associated with awake intubation. Thus, it's a win-win for both the patient and the medical team. However, it's worth noting that this technique requires a high degree of skill and experience. It's not something you learn overnight. But as the saying goes, practice makes perfect. And this is no exception. The more an anesthesiologist practices, the better they become at navigating and managing the procedure. So, to sum it up, asleep fiber optic intubation is an integral part of modern medical procedures. It's a method that marries precision with patient safety and comfort. It's a testament to how far we've come in the medical field and how much we prioritize our patients' well-being. Now that we understand its importance, let's delve deeper into the 5 intubation methods. Our first method involves intubation without maintaining ventilation using an intubating oral airway. Now, let's delve into this technique and understand how it works. This method is primarily used in scenarios where maintaining ventilation isn't possible or isn't the priority. For instance, in emergency situations where a patient's airway is compromised and there's a need for immediate intubation. To begin, the intubating oral airway is inserted into the patient's mouth. This device serves as a conduit for the endotracheal tube, guiding it towards the larynx. It's important to remember that the size of the oral airway should match the patient's anatomy for a smooth and hassle-free process. Next, we introduce the endotracheal tube. It's fed through the oral airway until it reaches the larynx. It's here that we need to be especially careful. The larynx is a sensitive structure and any rough handling can cause complications. So gentle is the key. Once the tube is in position, it's time to confirm its placement. This is done by checking for bilateral chest rise and fall and listening for equal breath sounds on both sides. Remember, confirmation is crucial. It's the difference between a successful intubation and a potential medical emergency. And finally, the oral airway is removed, leaving the endotracheal tube in place. The tube is then secured to prevent accidental dislodgement. And voila, the procedure is complete. This method, while simple, requires skill and precision. It's not about speed, but about doing it right. Because in the end, the objective is to ensure the patient's safety and well-being. So that's it for the technique of intubation without maintaining ventilation using an intubating oral airway. A straightforward method, yet highly effective in certain situations. But remember, every patient is unique and so is every situation. Therefore, the choice of method should always be tailored to meet the individual needs of the patient. That's the first method, simple yet highly effective in certain situations. Moving on, the second method involves intubation without maintaining ventilation and without an oral airway. Picture this. You're in a situation where an oral airway is not available or not suitable. It's a bit more challenging, but as with anything in anesthesiology, practice and knowledge can get you through it. So, let's talk about how you would go about intubation under these circumstances. First off, you need to position the patient correctly. Typically, this is a supine position with the neck extended and the head tilted back. This helps to align the oral, pharyngeal, and laryngeal axes, making it easier for you to visualize the vocal cords. Next, you need to prepare your equipment. In this case, you'll be using a laryngoscope and an endotracheal tube. Make sure to check the light on your laryngoscope and ensure the endotracheal tube cuff is intact and inflates properly. Once you're all set, introduce the laryngoscope into the patient's mouth, sweeping the tongue to the left. You're aiming to visualize the glottis and vocal cords. It's important to remember that you should use the laryngoscope to lift, not pry. the patient's jaw open. Now, with the vocal cords in sight, it's time to introduce the endotracheal tube. Remember to keep the tube midline and aim for the glottis. If you meet resistance, don't force it. Instead, withdraw slightly and adjust your approach. Once the tube is past the vocal cords, you can inflate the cuff. This is done to prevent aspiration and to ensure a secure airway. Finally, confirm correct placement of the tube. You can do this by visualizing the tube passing through the vocal cords, observing chest rise and fall, and listening for bilateral breath sounds. Intubating without an oral airway and without maintaining ventilation is certainly more challenging, but it's a skill that can be invaluable in certain scenarios. Remember, practice makes perfect, and always prioritize patient safety. That covers our second method. It's a little more challenging, but with practice, it can be mastered. Our third method involves intubation while mask ventilating using an oral airway and an Aintree catheter. Now let's dive straight into it. This technique is a little more intricate than what we've previously discussed, but it's incredibly useful in particular situations. The primary goal here is to maintain ventilation during the intubation process, which can be crucial in some cases. First, we start with mask ventilation. Proper mask ventilation is vital to ensure oxygen delivery and carbon dioxide removal. It's like laying the foundation for a house. If your foundation is solid, the rest of the procedure will go much smoother. Then we introduce the oral airway. The oral airway helps to prevent obstruction of the airway by pulling the tongue away from the back of the throat. It's a simple tool, but it can make a world of difference in terms of maintaining an open airway. Now let's get to the interesting part, the Aintree catheter. The Aintree catheter is a versatile device. It's used as a conduit for the fiberoptic bronchoscope, and it can also be used to deliver oxygen during the intubation process. It's like having an extra pair of hands helping you out. The fiberoptic bronchoscope is then passed through the Aintree catheter, and the endotracheal tube is subsequently railroaded over the Aintree catheter. It's a bit like threading a needle. The Aintree catheter guides the endotracheal tube exactly where it needs to go. So what's the magic of this method? Well, it allows for continuous ventilation during the intubation process. This is crucial in patients with difficult airways or those who cannot tolerate apnea. In essence, this method combines the benefits of mask ventilation, the utility of an oral airway, and the versatility of the Aintree catheter. It's a bit more complex, but it offers a great deal of flexibility and control. That's the third method for you. It's a bit more complex, but extremely useful in certain scenarios. The fourth method involves intubation while ventilating through an LMA using an ETT exchanger. Now let's delve into the unique aspects of this approach and its step-by-step process. The laryngeal mask airway, or LMA, is a critical player in this method. It provides a secure airway for ventilation while the endotracheal tube, or ETT, is being exchanged. The LMA acts as a conduit, and it's through this conduit that the ETT exchanger is introduced. The ETT exchanger is a flexible, elongated device designed to facilitate the smooth exchange of one endotracheal tube for another. Its design is simple yet ingenious, allowing for an efficient and effective tube exchange while maintaining a patent airway. Now, let's walk through the steps involved in this method. First, the LMA is inserted and ventilation is established. It's crucial to ensure the LMA is properly seated and that effective ventilation is possible before proceeding. Once ventilation through the LMA is confirmed, the ETT exchanger is then introduced through the lumen of the LMA. The ETT exchanger should be gently advanced until it emerges from the distal end of the LMA. Next, the original ETT is removed, leaving the ETT exchanger in place. The new ETT is then threaded over the ETT exchanger. The ETT exchanger guides the new ETT into position, much like a rail guiding a train. Once the new ETT is in place and properly positioned, the ETT exchanger is carefully removed. The LMA is then removed, leaving the new ETT in place. The final step is to confirm correct positioning of the ETT and establish effective ventilation. This method, while a bit more complex, offers the advantage of maintaining ventilation throughout the intubation process. It's a blend of traditional and innovative techniques, providing an alternative approach when conventional methods may not be ideal. That's our fourth method, a perfect blend of traditional and modern intubation techniques. Last but not least, our fifth method involves intubation while ventilating through an LMA using an Aintree catheter. Now, this is an interesting technique as it brings together the advantages of both an LMA and an Aintree catheter. A laryngeal mask airway, or LMA, as many of you know, is a device used to keep the airway open, allowing for efficient ventilation. The entry catheter, on the other hand, is a specialized tool that facilitates smooth intubation. So how does this process work? Well, the first step is to properly position and secure the LMA. This is crucial because the LMA is our primary route for ventilation, and it also serves as a conduit for the entry catheter. Once the LMA is in place, the next step is to insert the entry catheter. The beauty of this catheter is that it has a larger internal diameter, which allows an endotracheal tube to be passed over it, serving as a conduit for intubation. It's kind of like having a guide or a path that leads directly to where we need to go. Now, once the entry catheter is through the LMA and into the trachea, we can pass an endotracheal tube over the catheter and into the trachea. This is where the magic happens. Because we've been ventilating through the LMA and the entry catheter is acting as our guide, we can achieve intubation with minimal disruption to ventilation. So, you see, the combination of the LMA and the entry catheter gives us a unique advantage. We're able to maintain adequate ventilation throughout the entire process, and we have a guiding path for intubation. This makes it an efficient and patient-friendly method, especially in cases where maintaining ventilation is of the utmost importance. With that, we've covered all 5 methods. Each has its own unique application and advantages. In conclusion, each intubation method offers unique benefits and is suited to different scenarios. Let's take a moment to reflect on what we've covered. First, we discussed intubation without maintaining ventilation using an intubating oral airway. This method, while direct and straightforward, does not provide continuous ventilation during the procedure and may not be suitable for patients with compromised respiratory function. We then moved on to the second method, which also involved intubation without maintaining ventilation, but without an oral airway. This technique requires a higher level of skill and precision, as it lacks the guiding structure provided by an oral airway. The third technique we explored was intubation while mask ventilating using an oral airway and an entry catheter. This method provides continuous ventilation and is particularly useful in patients with difficult airways or those who cannot tolerate periods of apnea. Next, we delved into intubation while ventilating through an LMA using an ETT exchanger. This technique provides a clear pathway for the endotracheal tube and allows for ventilation throughout the procedure. However, it requires the use of a specialized ETT exchanger. Finally, we discussed intubation while ventilating through an LMA using an entry catheter. Similar to the previous method, it provides continuous ventilation and a clear pathway for the tube, but uses an entry catheter instead of an ETT exchanger. In essence, choosing the right method hinges on a comprehensive understanding of each technique, the patient's condition, and the specific requirements of the medical procedure. Remember, the goal is not only to achieve successful intubation, but also to ensure the safety and comfort of the patient. Remember, the key to successful intubation is not just about knowing the steps, but understanding when and how to apply them. Stay safe and stay informed.